Hello, this is the introduction to the discussion session on the societal value of physiotherapy. Following the last general meeting in Dublin, the Professional Issues Working Group were directed to look at the issue of societal value of physiotherapy. Societal value is a more expansive view of health than strictly medical or cost issues and includes ethical and cultural aspects. The societal perspective is quickly gaining acceptability and turning into a prominent guiding tool in decision making in healthcare research, practice, and resource allocation. As healthcare resources become increasingly scarce, the need for effective priority setting and resource allocation becomes more critical, and it is important that physiotherapy will be poised to respond to challenges that might arise. As a first step to trying to explore the meaning and possible actions on this issue, the Professional Issues Working Group thought it would be beneficial to get a sense of different perspectives of the member organizations based on their understanding of their health systems, cultural and social circumstances. To do that, we set up a four-part survey. The first part looked at what are the components of societal value from our perspective and the significance in the concept. In the second part, MOs were asked to rate the societal value of physiotherapy for certain conditions, populations, and in different settings. The survey was uploaded to Survey Gizmo, a web-based survey service. The link to the survey was sent to MOs and a further reminder was sent at a later time. There were 31 responses, which were almost 82%, of which 5 were missing a few responses. Average and distribution of responses was calculated. These are the ranking of the components. The importance of different elements of societal value. The highest mark, as may be expected, were patient measures and then social values. Cost issues got relatively low marks, and it poses a question if this is realistic or maybe wishful thinking. While some of the conditions with the highest marks reflect conditions at the top of the burden of disease studies, some, such as sports medicine, are not, and are more a reflection on what we do rather than probably the value to society. It also seems that conditions which have traditionally been at the core of physiotherapy practice, such as MSK and neurology, for various age groups are rated higher than others which pose a large challenge for health systems and societies such as deconditioning, mental health, and obesity. And have a look at the respiratory and vascular. I'm not sure they will be that low at the time of pandemic and predisposing factors. But it is the nature of such things. They change with times and we need to be as dynamic as the changes are. These are the marks given for populations. The high marks given to elderly and frail are in contrast to studies examining societal value preferences, which have shown a bias mostly implicit to younger ages. And although sports medicine was high in conditions, it is athletes are quite low or relatively low in the population. So there is some discrepancies between the different themes. Results of settings seem to reflect current settings of physiotherapy practice and traditional health system settings. Again, the pandemic highlights the dynamic nature of societal value and needs, as telerehabilitation would probably rank higher than it did a year ago. So the survey provided us with a broad snapshot of how we rank the societal value of specific aspects of physiotherapy. It can serve as a source of information and deliberation and for further exploration. So the points we'd like to put forward for discussion are: how do the results compare to your country? What do you think the results mean? Where do we go from here? What do you recommend for MOs and for ERWCPT level? Thank you and see you soon, sort of.